June is Men's Health Month, and Movember is highlighting the urgent need for men's health advocacy, and the impact of neglecting men's health is profound. Joining us to talk a little bit more about that is Tim Nanswarren. Tim, thank you for joining us today.
Thank you for having me. It's a pleasure to be here.
So how does Movember plan to address this stigma surrounding men's health and encourage more men to seek preventative care?
Yeah. At Movember, we're best known for our campaign in November, where men shave and grow mustaches to raise awareness around men's health. But we're here in June, given that it's Men's Health Week through Father's Day, to really address some of the stigma and challenges that men face. So at Movember, we're not afraid to have a little fun while doing good. We want to use humor and relatable content to break down those barriers associated with men's health. We want to provide easy to access and understand content and materials to educate men on the challenges of their health around prostate cancer, testicular cancer, and mental health, and educate men about the benefits of preventative care and early detection. And lastly, we want to engage men where they are in their communities by having events and activities, such as the golf tournament we just threw on Monday to kick off Men's Health Week.
And how is Movember leading the charge and pushing the boundaries to focus on men's overall health?
Yeah, at Movember, we recognize the fact that unfortunately men die almost 4.5 years sooner than women for largely preventable issues. And so we want to be able to provide clear and easy steps that men can follow to improve their health, which we call the Men's Health 5. Number one, to stay connected, to make time for their friends and family and to stay connected with them. Number two, to talk more, to be able to open up to those friends and family, but to also be the person they can come to confide in for their own issues. Number three, we want them to know their numbers around prostate cancer. At age 50, men should be talking to their doctors about prostate cancer and getting a PSA test, and even earlier if they're in high-risk groups. Number four, we want them to know thy nuts. With testicular cancer being the #1 cause of cancer in young men as early as age 16, we want them to be able to understand what normal feels like and get tested and checked out if something goes wrong, because it is easily curable if caught early. And last but not least, we want them to move more. We want them to find activities that they enjoy, be more active, and engage in healthier and happier lifestyles.
And what steps can individuals and communities take to actively support men's health initiatives beyond Men's Health Month?
Yeah, what we really want to do is create a year-round movement that empowers men to focus and take charge of their own health. We want men to develop a greater personal awareness of their health and proactively seek care if they encounter issues. We also want them to develop a positive lifestyle, including positive habits and positive support networks, so when they do encounter issues, they're not going through it alone.
Viewers go for more information.
Your viewers can go to Movember.com to find more information about what we talked about, but also how to have tough but important conversations with the men in their lives, and also how to support and engage with Movember as we aim to change the face of men's health both in the U.S. and globally.
All right, Tim, thank you so much for taking the time.
Thank you for having me. It's been a pleasure.